Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Let's look at today's top medical news. Ultra-processed foods dominate US grocery carts, raising health concerns. Nearly half of all grocery purchases in the US and ultra-processed foods, raising alarms among public health experts. A new study published in the Public Health Nutrition analyzed over 33 million food items bought by 59,939 American households in 2020 using the NOVA classification system to assess levels of food processing. The research found that 48% of packaged food and 38% of beverages were ultra-processed foods heavily engineered with additives and ingredients rarely used in home cooking. These included soft drinks, snacks, mixed dishes, and soups. While whole foods like fruits and vegetables had minimal ultra-processed foods, they made up only a small share of overall purchases. Purchases of ultra-processed foods were highest among non-Hispanic white households, followed by Black, Hispanic, and other ethnic groups. Households with lower income and lower education levels also bought more ultra-processed foods regardless of race. This suggests persistent socio-economic and racial disparities in diet quality. Study on HOPE technique shows promise for safe lung preservation before transplantation. A study entitled Evaluation of Hypothermic Oxygenated Machine Perfusion for Lung Preservation has demonstrated that the hypothermic oxygenated machine perfusion technique is a safe and effective method for preserving donor lungs even with the total out-of-body times nearing 20 hours. The study presented by Jeannekens, MSc organ perfusionist or transplant coordinator at UMC Utrecht in the Netherlands was unveiled at the International Society of Heart and Lung Transplantation annual meeting in Boston. This technique has been used for preserving livers and kidneys and is undergoing trials for hearts, but it hasn't been widely studied for lung preservation, said Jeannekens. Ex vivo lung perfusion is an established method that allows donor lungs to be preserved and evaluated outside the body before transplantation. The lungs are connected to a pump and ventilator perfused with a physiological fluid and sometimes reconditioned. Typically, donor lungs are transported on ice then warmed to 37 degrees centigrade for functional testing using normothermic EVLP before being returned to ice until transplantation. Study warns of rising yellow fever threat amid global trends. A recent study published in NPJ Viruses warns that global trends such as urbanization, increased international travel, and expansion of mosquito habitat are heightening the risk of yellow fever spreading beyond its current epidemic regions. Yellow fever caused by yellow fever virus is an acute viral illness primarily transmitted by the Aedes aegypti mosquito, which thrives in urban environments. Unlike other mosquito-borne diseases, human infected with yellow fever viruses are efficient amplifiers, allowing the virus to spread rapidly in cities. Historically, yellow fever spread from Africa to Americas during the transatlantic slave trade. Although an effective vaccine was developed in the 1930s and mosquito eradication efforts in the Western Hemisphere curbed the virus for decades, recent outbreaks in Africa have raised concerns. These epidemics are attributed to factors such as human population growth, inadequate vaccine coverage, and poor mosquito control. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.